that are silently making you sick. I am Dr. Ksenia Novak, a cardiologist, and you will learn not only how to avoid these mistakes, but also one solution for each of them. I will tell you exactly what I tell my patients in my office, and please pay close attention, because mistake number 2 and number 1 are the most lethal of all. And I am sure that mistake number 1 is right now on your bedside table. And no, it is not what you are thinking. Attention! If you wake up to urinate all the time during the night, this is our mistake number 5. It is distressing. It does not let you sleep. You wake up all the time. That is what my patients tell me. But what they do not know is that this can happen because of 2 or 3 things that I am going to reveal to you right now. Number 1. Do you have varicose veins in your legs, or do they simply get swollen in the afternoon? Well, you need to know that a lot of water accumulates there, and the following happens. Many people work all day, arrive home at night with swollen legs, have dinner and then go to sleep. When they lie down, the water from the legs is reabsorbed and goes back into the blood, to the heart and to the kidneys. And of course, after lying down for 2, 3, or 4 hours, you start to urinate all the time. What is the solution? Raise your legs 2 to 3 hours before going to bed. You can do this sitting on a chair, with your legs supported on another chair, or on a slightly lower sofa with your legs on a small table. Do this for 40, 50 minutes or up to 1 hour. This will cause the fluid in your legs to start being reabsorbed, and if you do this 2 to 3 hours before going to bed, you will urinate before sleeping and will get up much less during the night. But be careful, because fluid accumulation in the legs can indicate a heart or kidney problem. In these cases, it is always essential to consult a cardiologist, a general physician, or The second reason why you get up to urinate all the time at night is using water the wrong way. What am I saying? I am saying something very simple. You should drink water all day long, from the moment you wake up until 2 or 3 hours before going to bed. I repeat, until 2 or 3 hours before going to bed, when you should reduce the amount of water you drink. You should only take small sips in the last 2 or 3 hours before sleeping. What do many people do? They leave a glass of water, and before going to sleep, they drink it all. And of course, 3, 4, 5 hours later, you will wake up 2 or 3 times to urinate. Waking up all the time increases blood pressure, alters your metabolism, your brain, your heart, and increases the risk of heart attacks and strokes. And that is not all, because it also increases the risk of slipping and falling. What is the solution? 2 to 3 hours before going to bed, drink only small sips. Do not drink large quantities. You should have drunk water from the moment you woke up until that time. I am not saying not to drink water. I am saying to reduce it before going to bed. Pay close attention now to those who eat dinner late and heavily. This is our mistake number 4. What happens? Eating dinner and going straight to bed forces your body to work for hours. Does it seem logical to you to eat and lie down? Where will your food be? In your stomach, which will be full and working, and this will increase acid reflux. In addition, your intestines will be receiving food, and your metabolism, which as you already know is slow at night, will be forced to absorb sugar and fats. In other words, your cortisol will be very high, and this will make you sleep poorly. Even if you manage to sleep, you will sleep badly. Because your cortisol will be high, you will be in a moment of stress. This not only makes you sleep poorly and increases your blood pressure and reflux, but as a cardiologist, I tell you that today we know that eating dinner late and heavily is associated with an increased risk of heart attacks and strokes among other problems. What is the solution? Have dinner at least 2 hours, or 3, if you can, before going to bed. This will allow your stomach to have already gotten rid of the food and your intestines to have already started a large part of the work. Your cortisol will begin to go down and you will sleep much better. But it is not just about sleeping, it is about resting much better. Mistake number 3 will surprise you, and it is that some people sleep in a dangerous position, especially under certain conditions. For example, be very careful if you sleep on your back, especially if you are overweight or have reflux. Sleeping on your back can make you snore more. And there are people who not only snore but their partners, when they go to the doctor, say, "Doctor, my husband or my wife stops breathing for a while and then starts breathing again, making a strange noise." And this is called obstructive sleep apnea. You can research this or write in our comments and I will tell you more. And this is extremely dangerous, because it causes your entire circulatory system to be affected, increases your blood pressure, and raises the chance of having heart attacks, strokes, and circulatory problems. In addition, these patients do not rest as they should, and you know that not sleeping well increases the risk of serious diseases. If you snore a lot, and especially if your partner says that you stop breathing or make a strange noise, look for a sleep specialist. In addition, as I already told you, this position increases the risk of acid reflux, especially when you are overweight and when you eat dinner right before lying down. Another position that is not very good and that many people use is sleeping on your stomach. You already know that your spine has special curves that, when you sleep on your stomach, end up being altered, and this causes back pain, worsens your sleep, and harms your spine. And you will say, "Doctor, so in what position should I sleep?" Well, for most people, the best position is lying on your left side with a pillow between your legs. This position has proven benefits for gastroesophageal reflux. It reduces reflux and allows blood to reach the heart better. Pregnant women also sleep better in this position, in addition to improving snoring and sleep apnea. I am not saying it eliminates it, but it improves it, especially when you place a pillow between your legs. And this greatly improves the alignment of your spine. Now, there is an important detail. It is very important that you sleep in a position that you can maintain. What do I mean by this? Many people watch this video and say, "Doctor, I am going to sleep on my left side forever." If you cannot sleep on your left side, then this position does not work for you. Find the best option for you. Left side, right side. Try placing a pillow between your legs. Pay attention now, because the last two mistakes are the most dangerous. The second mistake is getting up suddenly. If you are over 60 years old, diabetic, or take medication for high blood pressure, tell me in the comments if this has already happened to you. You woke up, got up, and bam! Dizziness, blurred vision, the feeling that you are going to faint. You cannot walk properly. You feel kind of dizzy. This is called orthostatic hypotension, and it can cause falls, fractures, and head injuries. In older adults, this happens mainly when you get up suddenly, for several reasons. First, because older adults, especially diabetics or people who take blood pressure medications, especially when they start taking them, do not perfectly control their blood pressure. And when you stand up, all the blood, because of gravity, obviously goes to your legs. Your heart takes a few seconds to receive enough blood again, and during those seconds, the amount of blood that reaches your brain decreases, which causes dizziness, blurred vision, or even fainting. In addition, remember that when you wake up you will be dehydrated, because 6, 7, or 8 hours have passed without drinking water while you were sleeping. I tell you the same thing I tell my patients as a cardiologist. Follow the 20 to 30 second rule. This is a very simple rule. Wake up, sit on the bed like I am now. Move the tips of your feet a little, your arms, stretch your body a little. If you have a glass of water on the bedside table, start drinking right away. Count to 20 and then stand up, waiting 5 to 10 seconds. The dizziness will take a little while to appear. If in 5 or 10 seconds the dizziness does not appear, only then start walking. Believe me, this detail that I am telling you can save lives and prevent accidents. Another important detail: do not have rugs near your bed. It is very common to step on rugs, slip, and fall. Avoid this if you are elderly, please. Many of you have fractures, falls, or serious injuries because of this simple detail, but well, we have reached the most dangerous mistake and, for me, one of the most common of all. That little bottle you have on your bedside table and take for I do not know how many years. The sleeping pill, you got used to taking it years ago. You cannot sleep without it. It was a neighbor, an uncle, a cousin, or a doctor who once you said you had insomnia, and he said, "Take this." And you kept taking it forever. In other words, you take sleeping pills without needing them, without knowing the danger that this can cause. Many elderly people take diazepam, alprazolam, without knowing the number of side effects these medications have. Just to mention a few. Addiction, you cannot stop. If you stop, you do not sleep. Tolerance. Each time you need higher doses to continue sleeping. And worst of all, even if you sleep, this affects the quality of your sleep. Because even though you fall asleep, your brain does not rest in the same way, and does not reach all stages of sleep. Many people say, "I took it because otherwise I would not sleep." Well, I want you to know that this medication helps you fall asleep, but it does not make you rest well. It alters the stages of your sleep. And if you have been doing this for years, even worse. This also increases the possibility of snoring or having apnea, as I told you today, and it increases your possibility of the next day having a cloudy, confused, and slow brain. Now, these medications are not bad by themselves. The problem is that many of you started taking them without necessity because someone carelessly prescribed them and you continued taking them forever. Please tell me in the comments if this applies to you and which medications you take. What is the solution? First, if you have been taking this medication for many years, do not stop abruptly, because it is obvious that you will not be able to sleep. Go to the doctor and say, "Doctor, I want to try to reduce my medication. What can I do now?" I am going to give you 5 or 6 essential tips. Number 2, never self-medicate. If you take this medication by medical recommendation, ask, "Doctor, what is this for? For how long do I need to take it? Is this the lowest necessary dose? When should I stop taking it?" This is fundamental. These medications are for a specific situation, for one day or 1 week, during a specific moment, but not for long-term use. Imagine the following. Your kitchen catches fire once a month, every month, for years, and you keep putting out and putting out and putting out the fire. That makes no sense at all. What you need to do is prevent the fire. In this case, what you need to do is prevent and treat insomnia, not just put out the fire of not being able to sleep. Here are some quick and practical tips. Try to sleep at the same time every day. This will activate your biological clock and make you feel sleepy. For example, always at 10 at night. Also, try to wake up at the same time every day. This routine is fundamental. When you wake up, go to a window and let sunlight enter your eyes quickly. This will reset your new sleep clock for 10 at night. For example, avoid stimulants in the afternoon. Do not drink coffee, mate, or tea after 2 or 3 in the afternoon, especially if you metabolize these substances slowly. Number 3, avoid blue lights, computer screens, cell phones, and so on. Or at least turn on a nightlight and try to keep it on for 2 hours before sleeping. They stimulate your brain, make you agitated, drive you crazy, and of course, you will not be able to sleep. Number 4, try to choose a correct position to sleep. Number 5, manage stress correctly. Stay away from toxic relationships. Stay away from problems you do not need. If you cannot control it, keep yourself busy. But do not worry. Do not drink a lot of water 2 to 3 hours before sleeping, and do not eat dinner late. Please, do not self-medicate. Always consult a doctor. Did you like this video? What do you want us to do in the next video? Leave a comment. Also, tell me where you are following us from. I will answer as many questions as I can.